Hi, welcome. We're going to get started right around 7. So if you're already on, we'll be starting really soon. Thanks for being here with us. We are super excited to share tonight about prenatal testing and to hopefully answer some of your questions that you may have, whether you are early on in pregnancy or a little bit later on, or maybe you are um, trying to get pregnant and wanting to know more about what that journey might look like for you. So thanks so much for joining me tonight. My name is Allison Rollins. I am a co-owner of High Country Doulas, and I love to help support moms, dads, and birthing people through that journey of pregnancy, labor, and birth, and then into that postpartum period. And we really want to make that time less stressful for you, and to help you answer your questions as much as we can and provide that relationship for you to kind of understand what's going on with your body through all that time. So thanks so much for being here. If you're logged on, we're going to go ahead and get started. So pregnancy really can be that really great time of transition. It's a really transitional time. Your body changes. There's a lot going on. Sometimes that can bring on stresses and worries, and really understanding what's happening and what is going on throughout that process can be really helpful and really take away some of those concerns that you might have. There are lots of choices that you'll need to make as you await your baby's arrival. And I'm really passionate about empowering people to make those choices that are best for them, their babies, and their families. So welcome, everybody. Like I said, my name's Allison Rollins, and I am the co-owner and doula and health coach here at High Country Doulas. All right. So during your pregnancy, you're going to visit with your obstetrical care provider, your midwife, or your OB. Maybe you might visit with a nurse practitioner on a pretty regular basis. And at each visit, your provider is really going to evaluate how your pregnancy is going, what's the progress, the assets of the growth and the health of your baby. Your provider will use a series of tests to help determine how you and your baby are doing. And today we're going to take a look at the recommended prenatal testing that will be likely offered to you during your pregnancy. The specific test given in the timelines in which they are given may vary a little bit from provider to provider, but let's go ahead and get started. When it comes to prenatal testing, there are basically two types of tests. So we have screening tests and diagnostic tests. Screening tests, of course, are assess the chances that you or your baby of having a health condition. The screening only tells your provider if you are more likely to have a health condition. If the screening test indicates that you or your baby may have a health condition, there you go, sorry. Oops, I got off a little bit. Hold on just one second. Okay, I want to make sure I'm on the right slide. I feel like I'm behind. So if the screening test does indicate that you or your baby have a health condition, a diagnostic test will then be done. And diagnostic tests are done to confirm that you or your baby have a suspected health condition. Awesome. So we're talking about first trimester. You may be in your first couple of weeks of pregnancy. You may have already had some of this testing done, or you may be awaiting this testing. So you're really kind of curious about what's going on and what are they checking for. During your first prenatal visit, your provider may perform a urine and blood test. Common blood test that they may do would be a blood typing. okay? If you're A, B, all that kind of stuff. An Rh factor, so if you're positive or negative. A rubella immunity screening to see if you have any immunity to rubella. Most of us do. An anemia screening, so looking at low iron there. Hepatitis B, HIV testing, screening for sexually transmitted infections such as syphilis, gonorrhea, and other sexually transmitted infections. The urine tests that are common during this time are just a pregnancy confirmation, of course, kidney and urinary tract infections that might be going on that you don't know about, and a glucose screening, so blood sugar. Your provider may also order an ultrasound to verify your estimated due date, and a chorionic villus sampling screening to screen for chromosomal abnormalities such as Down syndrome, Tay-Sachs disease, and Fragile X syndrome. So those are just a couple of it. We're going to take a look at these tests and what they are. Awesome. So the blood typing and Rh factor screenings, you may have already had this done, or you may be getting ready to have this done. Basically, it's going to tell what your blood type is. Some of you, if you've given blood before, you may have a Red Cross card that tells you what your blood type is, but a lot of women don't know what their blood type is. Some of them don't even know if they're positive or negative. So possible blood types, of course, are A, B, AB, and O. The Rh factor, the rhesus factor, which is called, is a protein found on the red blood cells. And what this is, if you have this protein, you are considered Rh positive. If you do not have this protein, however, you are considered Rh negative. Rh positive is the most common blood type. If you are Rh positive, you don't have to do anything. However, if you happen to be negative, your doctor will recommend an Rh immune globulin injection to prevent your body from producing any antibodies from the baby. So they'll talk to you a little bit more about that. It's really simple process and can be really important in the health of your baby. So the next one's rubella immunity screening. Rubella, most of you knows what that is. It's German measles. Rubella is a disease that can cause birth defects in your baby if you become infected with the virus during pregnancy. This screening test basically looks for antibodies to see if you have any immunity to it. When antibodies are present, you're considered immune to the virus. No further action is taken. And if you're not immune, they will recommend that you get the vaccine booster. Your provider will encourage you or anyone with the disease while pregnant just to make sure that you're safe and don't catch that. Let's see, anemia. So anemia is another screening. This tests for levels of iron present in the blood. It is common for women to have lower levels during pregnancy. Anemia could cause you to be more tired during pregnancy or weak. And oftentimes they will recommend supplementing with some iron. A lot of times prenatal vitamins already have iron in that. So talk with your doctor if you're concerned about that or would like to learn more about how you can eat foods higher in iron to help support that. Vitamin C is really helpful in uptake of iron, so it's really great to be able to eat that alongside when you eat iron-rich foods. If it would be left untreated, anemia can lead to premature delivery of the baby, low birth weight, increased risk of needing a blood transfusion, and increased likelihood of anemia in your baby. So the anemia screening will identify the cause of the anemia, and your healthcare provider will recommend whatever treatment. So treatment typically involves supplementing, like I said, with iron, folate, B12. Also, your blood will be tested for platelet counts, and this test can reveal if you have any blood clotting disorders, which would be important to know. Awesome. So the next test we're going to talk about are hepatitis B testing, HIV, and STIs. So hepatitis B is a virus that can cause liver damage. severe illness, and in some cases, death. During pregnancy, your provider will test your blood to see if you're a carrier for this virus. If you test negative, your provider may recommend a hepatitis B vaccine to you, as it is considered safe during pregnancy. Because hepatitis B virus can be passed to baby during birth, if you test positive for the virus, special precautions may be taken during the birth to minimize the risk of infection to baby. HIV, of course, is a virus as well, and it does attack the immune system, also known as human immunodeficiency virus. HIV can be passed along to baby during pregnancy and birth. If you test positive for HIV, your doctor can prescribe medications to minimize the possibility that your baby becomes infected during birth and pregnancy. So sexually transmitted infection screening. During early pregnancy, your blood will be tested for syphilis and chlamydia. And in some areas, you may also be tested for gonorrhea. Treatment for chlamydia can increase, untreated chlamydia, can increase your risk of preterm birth and miscarriage. If your baby is exposed during birth, pneumonia or severe eye infection could result. So it's really important to be screened for this. Untreated syphilis can result in miscarriage, stillbirth, death of the baby, and neurological problems. Your baby can get syphilis from you at any time during pregnancy, so early diagnosis and treatment are important. Untreated gonorrhea during pregnancy can result in miscarriage and premature birth, and it is possible for the baby to contract it during birth, which may result in infection of the eyes that can be quite severe. So those you may not be at risk for, and it may not be an issue for you, but we just want to let you know about why they're screening and what the process is with that. So the next test, as you can see here, are urine tests. And urine tests are going to help us to detect glucose in your urine and see how high your blood sugar counts can be. Really, during your first visit, they're going to screen to confirm through your urine that you are pregnant, and they will continue to screen. Many providers continue to screen these to detect other things like bladder or kidney infections. Those can be instrumental for moms who may have like preterm contractions, which you don't want to have, no fun. Urine screenings, testing glucose in excess amounts. This could be a sign of diabetes, and that may be just gestational diabetes, which is just during pregnancy. But as a health coach, I also know that women who tend to have gestational diabetes are more at risk for having adult diabetes later on. So it's really important to talk with a nutritionist or a health coach that can help you manage your diet so you would be less at risk and really understand how that works for you. All right. Another important thing is to detect protein in your urine test, which can be a sign of preeclampsia. Okay. The urine screening may also detect dehydration. If you're not drinking enough water during pregnancy, that's really important. You're growing a baby, and there's so much need for you to have adequate water. It also checks for ketones and other bacterias. All right, next comes our ultrasound. So this is sort of the more fun and exciting side of screenings and testing. So the early ultrasound can really get us super excited about being pregnant and really kind of engage with our baby in a different way. Technology allows us to be able to see our babies. So when prenatal care begins, many providers will schedule you an ultrasound to date the pregnancy and to check for heartbeat, verify the pregnancy is in the correct location, and check for multiples. So they'll check for the location of the placenta, and just see how everything's going. There's lots of lots of different things they're looking for there. First trimester ultrasounds can be performed either transvaginally or transabdominally. You can see here in the picture, this is transabdominally. Transvaginally would be sort of a wand that they insert inside your vagina to see. And that sometimes can give a clearer picture in early pregnancy when baby is really small. In the early weeks, like 8 weeks. Okay, the transabdominal ultrasound, which is what most of you probably have seen and kind of know a little bit more about, is going to conduct around the abdomen wall and your lower belly. This probe can be used to scan the abdomen and into the uterus and obtain images. So both of these are going to give your doctors images of the baby. Many providers will ask you to drink at least 2 glasses of water an hour before your very first ultrasound. This helps fill the bladder, displacing other organs in the pelvis, and allows a more direct view of the uterus. The next thing we're going to talk about is the CVS, or chorionic villus sampling screening. This screen is a test that screens for chromosomal abnormalities such as Down syndrome, Tay-Sachs disease, and Fragile X syndrome. This test cannot detect neural tube defects or spina bifida. Providers will typically recommend this test to those who have risk factors. So age is a risk factor for that, and several other things. So they'll talk to you directly about that if you might be more at risk for these. It is considered a more invasive test and is typically done between 10 and 12 weeks. Samples of the tissues are taken either through the cervix using a gentle suction or through the abdomen with a needle. The benefits and risk of this test should be discussed really with your healthcare provider. So moving on, we're in second trimester. Next, your belly's starting to grow more and you're getting a little bit more like real. Pregnancy is a little more real in the second trimester. During your second trimester, your provider will continue to monitor you overall by screening urine, blood pressure, and weight. Additional screenings that might be offered to you would be the MSAFP, the maternal serum alpha fetal protein, a quad test screening, a 21-week anatomy scan, fetal Doppler ultrasound, glucose tests, and an amniocentesis. Okay. The maternal serum alpha fetal protein screening is a maternal blood test that looks for markers for possible neural tube defects, such as spina bifida. This screening is typically offered between 15 and 20 weeks of pregnancy and is conducted by drawing a small amount of the expectant person's blood and screening for its presence of alpha fetal protein. If this test does come back positive, your physician would probably recommend further testing to be sure that that's what's going on. There's also what's called the quad screening. So the quad screen looks for 4 substances in the maternal blood that may indicate genetic disorders: neural tube defects, Down syndrome, trisomy 18. Much like the MSAFP test, the quad is performed by taking a small sample of expectant person's blood. The quad screen is typically offered between week 16 and 18. And the 4 markers that they're looking for here in this quad screen is alpha fetal protein, human chorionic gonadotrophin, estrol, and inhibin A. These results are if they are abnormal, of course, your doctor may recommend just additional testing to be sure. Next comes anatomy scan and a fetal Doppler. So anatomy scan is commonly performed around 18 to 22 weeks. During the scan, your transabdominal ultrasound is used to visualize your baby. So you get to see pictures. This is exciting. And their overall anatomy, as well as their internal organs and potentially any defects that are going on. One of the most exciting parts is the potential for finding out your baby's sex. So a lot of people really look forward to this. The anatomy scan does examine the baby's heart, brain, spine, face, kidneys, stomach, and abdomen. And this scan will also look for the position of the placenta. So if you had an early scan or ultrasound, and doctor said that the position of the placenta was low-lying, this is a really good time to be able to see how that placenta maybe have grown up. Usually our bodies are just amazing, and oftentimes the placenta will grow up and out of the way. But they do check for that. They also check for the volume of amniotic fluid, the attachment of the umbilical cord, and that the cord has 3 vessels in it. So that's super important. So a fetal Doppler is a type of ultrasound that measures the circulation and the blood flow in the uterus, the baby, and the placenta. Depending on your risk factors, the provider may recommend this test. Unlike an ultrasound, the fetal Doppler ultrasound does allow for visual and audible assessment of blood flow between baby, placenta, and uterus. Are you planning on finding out the sex of your baby at your anatomy scan? Maybe some of you guys are. Some people have a gut feeling about what their babies are. So it's really exciting to think about, and whether you're going to share that with others, or you're going to keep that to yourself as a surprise, or you're going to have a gender reveal party, whatever you're looking forward to. So you can share that if you're interested in the chat bar. Our next test is an amniocentesis. This is a diagnostic test, of course, that utilizes both ultrasound to guide the needle into the uterus to take a sample of the amniotic fluid. Amniotic fluid can tell a lot, and it's sent off to identify any chromosomal abnormalities, genetic disorders, or neural tube defects. If you're concerned about having this done, talk to your provider and really ask them if it's something that you feel like you need to, or if they feel like it might be important for you to have it done. Amniocentesis is often recommended after an abnormal MSAFP or a quad screen result, and it can be used to source the baby's DNA to verify the baby's paternity as well. An amniocentesis is also sometimes used in the 3rd trimester to check for further maturity of the lungs. So if you're at risk at all for premature delivery or anything, they will often give steroid shots to increase the maturation of the lungs, so that baby is more likely to not have any issues with breathing if they're going to be potentially born early. The benefits and the risk, of course, like I said before, just make sure that you discuss that with your healthcare provider. The next screening we're going to talk about is glucose. So glucose screening is used to identify those who may be at risk for gestational diabetes. This test is typically given at the end of 2nd trimester and between weeks 26 and 28. During this test, and a lot of moms really don't like this, they have you drink this really sugary drink called glucola, and it will test your blood sugar levels in one hour later. The test ultimately measures how your body is processing sugars. So are you able to deal with sugars really well? I always tell moms, like, eat a healthy, well-balanced diet. Make sure that you're pairing your proteins with your vegetables and those starches and sugars that you're craving in pregnancy. And exercise. Exercise can be a great way for your body to process sugar as well. Those can be really helpful to avoid that. But sometimes it's just unavoidable. So this is why we really want to screen for it. If your result is high, this may indicate that your body cannot process sugar properly and may be an indicator for gestational diabetes. And so when the result is high, the screening is considered positive, and the second test may be recommended at this point. The second test is called a glucose tolerance test, or GTT. Before your GTT, your provider may recommend that a certain diet be consumed for up to 3 days before this test. This diet is typically includes a higher amount of carbs, and you will need to fast for 12 to 14 hours before the test is administered. And then on the day of your day of the test, your blood will be drawn to establish a baseline blood sugar levels. You will then consume the sugary drink with higher concentrations of sugar. Your blood will be drawn every 4 hours for the following 3 hours, and your glucose levels measured at each interval. So this is typical. Your doctor may do this a little differently. So if you have a concern, just ask, like, what is your protocol with glucose screenings? If I end up having a positive screening, what happens then? If 2 of the 3 readings come back high, you will be diagnosed with gestational diabetes. Your provider will then recommend the best course of action. They may have you see a nutritionist, or you may work with a health coach who works with prenatal women like myself. Dietary changes that may be necessary, and if it's more extreme, then you may be prescribed a medication to help your blood sugar. It's really important to make sure that that's at the right level. Have you ever taken a glucose test before? Has anybody ever taken that? How was it? You can always put that in the chat screen. And we'll try to go through those questions at the end. So next is third trimester testing. Okay. Your belly is growing really rapidly, and you're feeling heavy at this time. Sleep may be an issue for you. But during your third trimester, your provider will continue to monitor your overall health and your health of your baby. They will screen your urine, blood pressure, check your weight at each visit. Your baby's heartbeat and position will also be checked, along with a measurement of your fundal height. So how high from your pubic bone up to the top of your fundus. They'll be checking that to see if that's on par with your weeks. Additional screening tests in the third trimester may include an Rh antibody screening, group B strep, non-stress, and a biophysical profile. So let's talk a little bit about the Rh antibody screening. For those of you who are Rh negative, my mom is Rh negative, a repeat antibody screen may be performed around the 28th week of pregnancy. If your blood still tests Rh negative, your doctor will recommend an Rh immune globulin injection to prevent you from developing any antibodies against baby. If this test is positive, it may mean yes. So if this test becomes positive, it may mean that you have developed antibodies to the baby's blood. This just will require closer observation of your baby. And occasionally it makes need for a baby to be born a little quicker, but usually not. Group B strep test. I get so many questions about this one. So Group B strep is called Group B streptococcus. It is a bacteria. So this bacteria lives in the rectum. Sometimes it will go and move or migrate, I'll say, to the vagina area, or it just gets more. It's in the vagina, but it just overgrows. Both women and men do have this. And approximately 25% of healthy adults have this bacteria in their body. So typically this bacteria does not cause a problem. However, the problem would be if it's passed to baby during a vaginal delivery, could result in illness or death. So it's a pretty serious if baby would catch it. So we do tests for that. The GBS test is performed the 35th and the 37th week. That's an estimate. Your provider may be a little different. This test is performed by taking a swab, basically, of your vagina and rectum and sending it to lab. If the test does come back positive, your doctor will want to give you IV antibiotics during labor. So it may mean that you may come in a little earlier than some or not, depending on what your provider is, but they do want to make sure that you get a good round of those IV antibiotics so the baby does not get the group B strep as they're being born. And they do give those to you during labor about every 4 hours. So it's good to know. All right, next comes the non-stress test. So this should be not stressful. It's a test that looks at the baby's heart rate in response to its movements. So as it's moving, we would check the baby's heart rate. This is called reactivity. And just as our heart rate increases as we move, the baby's heart rate will also increase as he or she moves. This test can be used after the 28th week of pregnancy, and it is conducted by attaching 2 bands to your belly. One band monitors heart rate, and the other monitors your uterus for contractions. This test typically takes about 20 to 30 minutes. It may take longer if your baby is asleep when the test begins. The non-stress, or NST as it's often called, is assessed as either reactive or non-reactive. The test is considered reactive when the baby's heart rate accelerates 2 or more times in a 20-minute period. This test is considered non-reactive if the baby's heart rate does not accelerate enough times in a 40-minute period. If it is suspected for some reason that baby may be sleeping, the provider may use a sound buzzer placed on your abdomen to emit short buzzing sounds and wake your baby. Next comes the biophysical profile, often called the BPP. It's an ultrasound test combined with the non-stress test to assess your baby's health. Oftentimes this is done as you get towards those final weeks, and a lot of times maybe more often if you are go beyond your 40 weeks. This test does monitor several aspects of your baby's health. It does heart rate, amniotic fluid, muscle tone, movement, and respiratory movements. So watching those lungs. Each aspect of your baby's health is basically given a score. A low score may indicate that more testing be done or that an earlier delivery is considered. This BPP is commonly used after the 32nd week of pregnancy, is typically recommended for those who have certain risk factors or are past their estimated due date. Yes, I already said that. So decisions. The decisions that you are making about the test are only the beginning of the decisions that you will make for the next 18 plus years. I can say this, I have a 21-year-old, 19, and a 15-and-a-half-year-old. So the life as a parent is full of decisions. While it can seem overwhelming, you're really only responsible for making the best decisions that you can with the information that you have. Don't expect perfect outcomes for our children. We really shouldn't expect it for ourselves, because we know that our children are not going to be perfect. They're going to need a little bit of grace, so we need to also give ourselves grace. Having sort of an unbiased support of a doula can also help make these decisions a little bit easier to navigate through. The support of a doula can be somebody who you can pick up the phone to and really talk to you about how you're feeling. We don't make recommendations or tell you what to do. We more or less provide you with the information that you need to make the decision that's right for you. So in summary, really, while some prenatal tests are standard and offered to every pregnant person, others may be only offered if you have certain risk factors. Your unique situation and your unique pregnancy will influence what the provider chooses and recommends for you. Genetic screening can be used to make decisions about the future of your pregnancy, or whatever special needs may need to be considered for your birth. Some individuals really prefer to avoid these screenings, as their results won't influence the remainder of their pregnancy. Really, the only right decision is the one that is best for you, and the ultimate decision is up to you. So the following resources were used to assemble this class. We had an AAFP guidelines for antepartum fetal surveillance, the Mayo Clinic first trimester screening, American Pregnancy Association prenatal testing, and ACOG's prenatal genetic screening and diagnostic testing. Thanks so much for being here tonight. If you're watching this live or if you're going to watch the recording of this, I hope that this information was helpful and kind of sets you up to understand what may happen or has happened for you during your pregnancy. There are many options, and I recognize that everyone will have a different approach to which test that they prefer. Your pregnancy care really is a partnership between you and your provider. And remember that to discuss those thoughts and concerns about the various tests so that you can understand them. Thanks so much for joining me tonight. And I will check and see real quick and see if there's any questions that you might have on the chat bar. All right. Let me just stop the sharing real quick. See. Anybody have any questions? Awesome. So if you have any additional questions or thoughts or concerns, you can always reach myself, Allison Rollins, or Samantha Lee Wright at info@highcountrydoulas.com, or you can give us a call on our business line. That's 828-278-8949. So thanks so much for joining me tonight. I hope you have a wonderful evening and have a wonderful pregnancy.